This is a Black Nouveau web exclusive.
Hi, I'm Harry Lennix. I'm here on the set of my hit NBC show, The Blacklist. Did you know that 1 in 6 African-American men will be diagnosed with prostate cancer? Compared to others, African-American men are 76% more likely to be diagnosed and over twice as likely to die from it. I'm here on behalf of the Prostate Cancer Foundation to get the word out. Know your risks, know the numbers. Learn more at pcf.org.
And we are joined now by actor Harry Lennix from NBC's The Blacklist and Christine Jones, Chief Operating Officer of the Prostate Cancer Foundation. Thanks for joining us.
Thanks for having us.
Harry, how and why did you get involved with the campaign?
You know, a couple of months ago, we did the Blue Jacket special. I think it was the second or third year during Fashion Week here in New York City. I was able to take part in that and met some of the very nice people doing great work on behalf of the Prostate Cancer Foundation. Of course, prostate cancer will affect 1 in every 6 black men. And the Prostate Cancer Foundation has been extremely assertive in going out and trying to make sure that black men are going in and starting to get their PSA tests when they go in for their yearly physical, hopefully starting at about the age of 40. For all other demographics of men starting at the age of 50. It's a blood test. They draw your blood and figure out whether your PSA levels are elevated and if there's something that needs to be done, even more in terms of being treated. But we also know that early detection and things that you could do to help prevent the disease in the first place saves lives. So as a black man who is deeply concerned with health in general, and also somebody who fully believes that what is good for black America is good for all America, what is good for black men is good for every man, we know that if we can get to the bottom of why this disparity exists in this particular disease and some of the other cancers, we can help save lives and bring this level of parity. And I am very grateful and very honored to be considered an ambassador for PCF and getting the word out here.
Christine, can you explain your campaign?
Yeah, sure. April is designated as Minority Health Month, and as Harry said, we thought this was a natural tie-in because the incidence of prostate cancer is so much higher among African American men, and he was kind enough to help us out. You've now seen the public service announcement that he did, and honestly, when you have a hit TV show, you have a wonderful spokesperson, and you have something that's this important, the stars align to bring attention to something that really needs attention. The other thing about the campaign, James, is we want to have awareness that there are resources and there are simple things that people can do to help themselves and to help people that they care about. There are a lot of resources that we have on our website at pcf.org, including a nutrition guide, which says just some basic things you can do to change your diet. An African American specific guide, which says, here's some additional information African Americans should know as it relates to prostate cancer and cancer in general. A patient guide for people that have been diagnosed or people who are caregivers. All of those sorts of things which are free, they're easy to share, they're easy to download, they're easy to talk about. And the most important thing that I could leave you with, if I had to pick one thing, is this. You have to talk to your doctor about being screened, because early screening leads to early treatment, which leads to survival. And today, if you're treated early, you have almost a 100% chance of survival, and that matters to us. So while we're trying to figure out why this disparity exists, help us help you, help us get the message out, make sure that you're taking care of screening and being diagnosed early.
Harry, there are some myths associated with prostate screening. Can you talk about some of those?
Yes, well, it's in a very inconvenient part of the body, one that we don't typically tend to associate with wanting to be experimented on. Black men in general, black people in general, have some skepticism when it comes to the medical industry for good reasons, going back a pretty long time. And since the beginning of our time here in the United States, and just some general sort of misinformation that's been put out there now as to how humiliating it is to get the test. But it's a blood draw, really. Of course, when my brother started getting his prostate examined at the age of 40, this is, I guess, about 20 years ago, the doctor would, it's like a proctologist, and that may happen here, but you don't have to do that anymore. It's now much more humane, as it were. But whatever the discomfort level, we need to face these disparities. I can tell you whatever the examination involves is way better than death. And there's a 100% chance, if you're not treated, of dying, and there's a 100% chance of surviving almost, 100% chance if you were detected early. So I am convinced that that an ounce of prevention, however, is worth a pound of cure. And the greatest prevention is getting in there and talking to your doctor. And if you were a lady, making sure that the men in your life are being tested as well.
Well, thanks a lot for joining us.
Thanks for having us, James.